We are quickly approaching the dates to enroll in Medicare and open enrollment for healthcare coverage for next year. We have two experts to help you navigate that process. Catherine CVA is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services. They're both here to answer your questions. This is how you get your questions to our experts for the day. You text in that question. The number is 336-379-5775. All right, so we're already looking to 2022 and our health care for 2022. Let's take a look at the dates so that you'll know when enrollment is going to start. They're a little different between Medicare and also the ACA as well. So first and foremost, let's take on Medicare.
So Medicare open enrollment is October the 15th and it ends on December the 7th. So this is the opportunity that people have to change their program if they want to move from Medicare, traditional Medicare, to Medicare Advantage, or to find a supplemental plan.
Okay, and so Medicare enrollment October 15th through the 7th. We've got the ACA healthcare right now from November 1st through December 15th. So Morgan, this is for next year. I know we just had an ACA enrollment period, but this one really is for 2022. Kind of go over when the coverage starts.
So when open enrollment starts with the ACA coverage, you will begin November 1st. And you will end December 15th. And any policy that you take out in that time will be effective January 1, 2022.
Okay, gotcha. All right. So, Catherine, let's talk about Medicare because there could be some changes this year when it comes to prescription drugs. What do you know?
What we are being told is that the rates for Medicare Part D are going to increase. And right now they're projecting about a 4.9% increase in the amount that you'll have to pay for Medicare Part D. We have not heard anything yet about Part B, but generally it goes up as at some other rate very similar to Part D. So we'll have to wait on that one unless Morgan's heard anything.
I have not heard anything as of yet. We're waiting for CMS to release that information.
Yep.
All right. So AARP, of course, keeping you up to date on that. So I don't doubt, ladies, that we will be talking to you again a little bit closer to the sign-in date as well. This person already has a question. They're saying, my husband is going to retire November of 2022, so next fall. When will we need to apply for Medicare? And it has nothing to do for when you retire. That is the key thing. Catherine, you want to start us off and then Morgan can kind of pick it up?
Absolutely. Medicare is an age-controlled benefit. So 3 months before your husband's 65th birthday to 3 months after. So there's a 7-month window where he needs to interact with Medicare about getting his Medicare started. Can't get it before then, and if he doesn't do it then, there is the risk of penalties for the rest of his lifetime receiving Medicare.
All right, so when you apply for Medicare is not based on when you retire. Now you can make sure that you kind of keep the Medicare coverage to a minimum so that you can use your regular work health insurance and then allow more Medicare benefits. Is that correct, Morgan?
Right. So once you have that Part B date established and you are actually losing employer coverage, you actually have 2 full months after you have lost that employer coverage to obtain new coverage without racking up a penalty.
Okay, so you have that time frame when you're retiring to make sure that you ramp up your Medicare benefits, but you do need to sign on for Medicare when it's the age appropriate time, not when it is the retirement time. All right, so we're going to be talking about Medicare Advantage policies and should you go back and forth between supplemental and regular. We're going to tackle that when we come back. Also, if you're thinking to yourself, well, I'm fine with my health care from last year, I don't need to really re-enroll and check the new boxes, Morgan's going to tell you different.